Welcome to Hope for Med.
Hope for Med.
All right. Hi, everyone. Welcome back to the Hope for Med podcast. I am your host, Dr. JB, and today's featured guest is Dr. Mamta Kumar. Dr. Kumar is a board-certified internal medicine and integrative medicine physician. She's a mom and a wife. She also is owner and CEO of Tera Investments and a real estate investor. Welcome to the show.
Oh, Dr. JB, thank you for having me.
So I am so excited to learn about your story. So let us go ahead and start from the beginning. Share with my listener your origin story.
Oh, well, yeah. So my story, I was born and raised in India and went to the medical college over there in one of the top 10 medical colleges. And, got married, and my husband was here. He was an IT professional. So came here to join him. Had full intention to go back to my own country, but, with time, just gave the USMLE exams and stuff. I finally got into the residency, did internal medicine residency, and then I graduated from that in 2012. Mm-hmm. After that, I had two girls, which were high risk. After the high risk pregnancy, complications, the youngest one was born at 24 weeks, and I have been trying, 2 years after residency. So for the last 8 years, I've been just trying to juggle, taking care of her, my own work, and the whole family and everything. Yeah.
And how has that juggle been for you?
Oh, very, very hard, almost impossible, as you would assume, because I really think as physicians, we're ingrained to take care of others. And that is just so ingrained in us so that, we don't even think about we need to slow down to take care of ourselves as well. So I really think it was very hard after being in the bed rest, having that baby, who was at high risk, and our medical system and our healthcare system is not as forgiving, because for them, we are just physicians and we need to get back to work. So I remember leaving my baby in NICU and going back to work, which was so traumatic. And I didn't know what was going on with me at that time. But she stayed in NICU pretty close to 5 months. And among that 5 month period, 3 months, I was back to work. And after that, I was like, well, something is wrong here. Something is just not making sense. I'm a physician. I see the patients like this or their moms, and I would tell them to prioritize their own health, take care of themselves and their kiddos, and do whatever is needed for that. And here I was compromising my own health, my daughter and my family's safety, and then going back to work and leaving that baby. And anyone in the sane mind, even a physician, we know that we want moms to be with the kiddo, in NICU. But here I was just because I was a physician, I was not given a chance to be a mom. So, after that, things definitely changed in my mind, that how I viewed medicine, parenting and things like that. And after that, I had switched, I was fresh internal medicine graduate at that time, and I was working full-time as a primary care physician. Then I switched to urgent care, switched to PRN, then did nocturnist, full-time nocturnist job. And then finally, before I left my last job, I was part-time daytime hospitalist. So I had switched to job every 1.5 years. Mm-hmm. Just trying to find that job, and so that I could balance it all. But there was just no balance, because I don't think it was possible.
So walk me through what you were thinking about when you made all these switches, and why you thought that with each switch, things would be better, you'd be able to better balance. Can you explain that a little bit more?
So in my mind, I think what was going on was, I went to medical college when I was 20, and I left my home. I had no physician in my family. I was a first physician. I was first female who had done distance education. So there was no one there to guide me or connect with me. All my friends there were, the doctors. We are very type A personalities who want to achieve this and that. So when I have this 24-weeker baby who was having complications after complications, for me, it was still a struggle that maybe if I push hard enough, I'll be okay. And then I can go through this. And I almost became a therapist for her, like as a doctor, just like when we see the patients, we recommend them to have this kind of therapy, that kind of therapy for this many hours. So I would be working and I would come back home. I was just not able to switch to mom hat. I was still in the fixing mode and I would be like, oh, PT suggested to do this many exercises for this many times. So I'm going to go ahead and do this. And then the OT suggested this. So my days with my daughter went like that. And after a year and a half, I realized that there was something was just missing. I was not treating her like my daughter, but I was treating her like a doctor would to her patients. So that was something which, was eye-opening for me. And I was like, you know what, then in that case, what do I do to become a mom? Somebody who can support her, and then I realized, well, I didn't have any support system as well at that time. And I had switched places, as physicians, we talk so much about work. I was just not able to talk to anyone about this. I didn't know any other mom who would be going through this, like living a different life behind, a successful physician job. Everybody was like, oh, well, oh my gosh, you're doing such a great job. You're able to do both. But how hard it was for me to be able to do both jobs. That's why I was trying to kind of just switch the jobs, because each time I would make a goal that, oh, she would be doing way better in 1 year. And then I'll be able to go back to work full time, because I had known nothing in my life other than medicine. So my goal was to keep up with my peers and then go back to work, whenever time is right. So that was, and then until like 2 years ago, because now she's 7, but at that time she was 5. But she was still requiring so much that I was like, you know what? There's no way I can balance it all. I have to just make a choice. Is she my priority or am I going back to work? And I think things became way easier when I just decided that, well, it's okay to be her mom first and do whatever is needed to be done for her benefit and be with her, because that's what I would tell to my patients anyways, or any good pediatrician will tell their patients. I know it was a very hard call, but I think that's what was going on in my mind at that time.
So, just to clarify, with each of these switches, so you said when you graduated from internal medicine residency, you went to work in what setting? The hospital?
It was an outpatient setting, full time.
Okay. And that was what, Monday to Friday, 40 hours a week?
Yeah.
And then you transitioned from outpatient to what next?
Well, in the same, I had a hard time negotiating that, but finally I was able to negotiate that I'll be doing, certain shifts, because my daughter was requiring she had too many appointments and there was like too much therapies to keep up with. And I had started to feel sick too at that time. I was diagnosed with autoimmune illness and I was not surprised because I was just trying to push through so much. So I cut down my shifts at the same workplace. Mm-hmm. But they didn't want to take away me from a PCP status. So everybody was still looking for me, because the patients, they were like, I think at that time, 2,000 to 4,000, I don't remember the exact number, but they were assigned to me as a primary care physician, and they would just randomly, sometimes they will just bump into me when I was doing my cut down, shifts. They're like, oh, now I see you are my primary care physician. I have been looking for you for a year or so, or something like that. So that was very traumatic for me, because I was like, you know what? I do not want you to be looking for me, because there's no way I'm going to be coming back to work full time. So I fought hard for that. And eventually they let me go off the PCP status with very hard time in the same institution. And they switched me to a different location, which was urgent care. In that, I would just choose the shifts, which I could do depending upon my daughter's schedule.
Mm-hmm. But then you transitioned from urgent care to hospital?
Nighttime hospitalist, because my daughter was still requiring quite a bit of, she had extreme feeding issues. She would just not eat. Mm-hmm. So there was no way I could just leave her in hands of others. So I thought maybe me being the nocturnist, I'll be gone in the nighttime. In the daytime, I don't know why and how I came up with this. I didn't think my sleep was so important. I was like, you know what, I'll be at home. Mm-hmm. And at least even if I will have help, I'll be here. If she's crying too hard, if she's having bust, then, and I had like a feeding program, which was pretty intensive. And I knew by that time that it's not going to be 1 or 2 month deal. It was going to be months or years deal. So that's what pushed me towards choosing that shift and the role.
And how did that work out?
Oh my gosh. Like after I was already diagnosed with autoimmune illness at that time, within 4 months, my body just started to give up. I just could not. But, I had 6 months notice period. So within 4 months, I realized that it was time to go ahead and give the notice. I didn't care if I was going to find a job or not at that time, or I will find a job because my place, like where we stay, is a very competitive place. So I was like, you know what? I don't care if I don't get a job or not, but I need to go ahead and put this resignation in. So I put the resignation in 6 months. I still continued to work for 6 more months before I left there.
Did you say 6 months resignation? So it's not like a 2-week thing, right?
No. For the nocturnist, they made it 6 months. I was like, gosh, like, are we slaves? Like, aren't we humans? Like, we have a choice. Yeah.
Wow.
Yeah.
And then after the nocturnist hospitalist job, what happened next?
So I had no job when I left, but I felt free. I took my time off, focused on my daughter. My goal was, again, like in 6 months, to get her where I wanted her to be so that she's going to be independent and I could go back to work. So I know I was still chasing that goal by that time. So I think I signed a contract in 4 months and I started to work again in 7 or 8 months. After 8 months gap, I was back working as a part-time day hospitalist where I would work 7 days a month. So it was 80 hours per week and 3 weeks off. So I was like, you know what, that will give me enough time to focus on the other things, everything in my own health too. So that was the last setting I was in.
And you mentioned earlier that, when you were working as a physician, you felt like you were compromising not only your care to your daughter who was in the NICU, and you had to leave her there for 2 months in the NICU to go back to work, but also your own health too. So can we explore that a little bit more, what you meant by that?
Oh, well, so when I was working as a nocturnist, I think to make it a little more clearer and easier on the audience, I think it's good to know like where my daughter was. She had a G tube and we used to feed her through the G tube. And most of the feedings would go into nighttime because she was not able to tolerate the daytime feedings. And we were trying to keep her hungry so that she would be hungry and she would eat and explore more foods. So that was a plan which we were trying to do. So that meant even in my last full-time nocturnist job. So 1 week while I was gone, my husband will do that, make sure that she was getting the feedings in the middle of the night. And somehow she would have pain or something and she would stay up. So whoever was giving the feeding had to do set up timer, which will go on, 30 minutes period till 2 a.m. so that we would go and do the bolus feeding in the nighttime. So when I was working for a week, he would be doing that. And when I was back and at home, I would be working intensively with her in the daytime where she would cry, she doesn't want to eat, so that was a lot of emotions to take. But I was like, you know what, with all the help of all the therapists, I'm like, we're going to just tough it out and we'll just give her some time and then let her be hungry. But in the nighttime, we had to do the same drill. So basically I was up in the daytime, I was up in the nighttime. So there was no recovery time for me. It was not a job so I was stressed at the job as physicians, as we always are. And at home, it was the same because I just couldn't let it go. I don't know if I should have let it go or I could have let it go, but it was just becoming so hard to just find that time to relax or even get enough sleep. Yeah.
And then you yourself had an autoimmune disorder.
So I was dealing with the fatigue and the brain fog from lack of sleep. I was put on something for sleep at the nighttime by my doctor at that time. I was given stimulant in the morning time. So my heart would be racing by the whole day. I was like, what game I'm trying to play with my life and my own health. This just doesn't make any sense.
And so and you were diagnosed with the autoimmune disorder after your second child was born.
Yeah, same year after she was born. So, yeah.
Wow. But you are no longer practicing actively in the hospital. So tell me about that transition. What made you decide to, completely pull back?
So I think in my last job, when I was working for a week, 80 hours per week, and I had 3 weeks off, I started a side gig where I started to buy and sell vacant land. So that was something which I was like, you know what, with my state, I don't think I can ever work full time on a state part time because I love medicine, because that's what I thought at that time. And then I wanted to do some other, investments, real estate investments on the side to keep up the income so that we will, my goal was nothing else other than to supplement the income to match my regular physician income. But when pandemic hit, my daughter at that time was requiring pretty close to 46 hours of therapy. And she was going to a specialized center. And here I was dealing with autoimmune illness. So just over the weekend, almost 2 years ago, like today's February 16th, I think it was March 18th in 2020, where my shift was about to begin. And then this whole drama was going on that how my hospital was preparing for the COVID patients. They had the same mask. You would be given one N95 mask, which you would be wearing for 5 days or throughout your shift, and then you return it. There were not enough PPE. There were not much protocols going on. So with my own autoimmune illness, I was at high risk of COVID complications, and here my daughter was going to go too. So I didn't think it made any sense for our family to just get affected by this. So I and my husband decided that it would be best for me to just stay at home. Mm-hmm. So I put in a leave of absence, medical leave, application. Even at that time in the hospital, they have no rules. They were like, well, you can come back to work, and once the patient is confirmed with the COVID, then we'll take the patients away from you. And I was like, well, that will be too late because I have something affecting my lungs. I was dealing with respiratory infections every 3 months anyways at my baseline. I was taking steroids, I was taking antibiotics. I was like, you know what, this is not acceptable to me. So I had to reach out to the CEO of a big organization, and they were like, yeah, I totally agree. If I were you, you need to stay at home. So I just decided to stay at home at that time.
Mm-hmm. And I know you said that you love medicine. So how was that decision to, what were the emotions around that decision for you?
Gosh, yeah, that is a very interesting question, because I thought medicine was the only thing which I loved way before I had family. I mean, I had never questioned that I love medicine and I will always be doing medicine. That was something which my 20-year-old had decided. Mm-hmm. And now I was almost like 39 at that time. I was like, you know what? It'll be so painful and probably it'll be so hard. But just after 2 days of turmoil, I think by Monday, I was like back in love with my life, because there was no more stress and there was no more dilemma. As I told you before, I was always trying to juggle and find that balance where how could I continue to practice medicine because I love it so much and there's nothing else I know. But just over the weekend, I just felt free somehow. I was like, you know what, now I do not have to go back and look for another job to see which job will fit my need the best. And I could just be a mom and I could just be me, and our family can just, so it was very freeing. It was very, very freeing. I thought it would be traumatic. I had never imagined I would have any other response other than just feeling so torn. But honestly, I have felt that pain all this long that I was just trying to find that balance. So I just felt relieved. Somehow I felt very calm, at peace. Mm-hmm. I was like, wow. I'm like, yeah, I felt like freedom.
Mm-hmm. It sounds to me like you were trying. You were trying so hard, right? By changing from one job to another job, and trying to juggle and do it all. And, especially with having a special needs child that needs so much of your time and your attention, and, your daughter has all these different appointments and specialists that she has to see. And then you also mentioned that you didn't have a lot of support. So do you have family or anything around you or anybody around you that you could lean on during this time?
Now, since we are immigrants and like we have no family members here in country, there were some times where our parents were able to visit for a short period. But usually, I just, we usually until 2 years ago before the pandemic, we used to have a live-in nanny for my daughter because she was just too much for me to be able to take care of her alone by myself. And we always had ABA therapist at home, OT, PT, speech. So basically, they were always the support system, and they would just come at home. With home, I could just strategize, plan, and do things which was best for our family and her.
Mm-hmm. Mm-hmm. And then you also mentioned that you got into buying land, so tell me a little bit, what made you decide land as, the vehicle to operate out of?
So I was always looking for something which I could do virtually because I was dealing with autoimmune illness. I had fatigue going on, and I wanted that something which I could do virtually on my own terms, in my own free time. I wanted that flexibility. So I started this virtual land business after one of our family friends, he was doing it and he was successful at that time, he was profiting from that. So I was like, you know what? I don't know anything else to do, but this is something which I could do in between my daughter when she's playing with her therapist or getting therapy, or between the appointments or in the middle of the night or whenever I want to, because this whole model is virtual. You can do it from anywhere. All you need is a laptop and have that ability to analyze the deals and, and do the marketing to, get the land and then market and sell it. So I started it that way because I had an example right in front of, as who told us, or this is how, so we started just to try kind of see if this is even possible for us, like I and my husband at that time. So yeah, that's how we started because I was looking for something which will just give me time freedom and can be done virtually. I don't have to travel and things like that. So that's how we got the feet wet.
Mm-hmm. So is it scary to buy a land if you don't actually see it, walking?
I really think, with the house, I think definitely anybody would be very scared because there's so many things which could be wrong. But with the vacant land, I really think if you do your enough research, then there's very limited things which could be wrong. Well, there's no structure in there, which needs to be appraised or stuff like that. There's going to be no termites. There's going to be no flooring, roof issues. So the vacant land is a vacant land. So I really think the way that is valued is way different. Mm-hmm. You need those skills, but the way that is valued is way different than the houses. Mm-hmm. So I really thought, even though we were thinking about doing some house investments, which we did last year, but land was something I was like, you know what? All you need is to spend time to just analyze the area, know the neighborhood and things like that. And then once you do enough research and know the fine, tiny details on that, I really think I felt comfortable,
Mm-hmm. And that was able to supplement your income.
Yeah. I mean, till then, I think even when I was working as a part-time hospitalist, it was able to supplement the income and bring it to where I wanted it to be as a full-time hospitalist salary. But in the pandemic, when I pushed through more and I did more and expanded, hired the team, to a little more structure in that, then we are definitely able to do way more than what physician salary would have been. So I really think it's definitely replaced that for me. And it still gives me the freedom where I do the business when my daughter is at school, and then I go and pick her up. And after that, depending upon if she has therapy appointment, then I can, because there's so much flexibility in this, especially since I have the team, I can tell them what to do and things like that, mm-hmm. and make the major decisions in my freedom, in my time. Mm-hmm. So, yeah.
So you mentioned freedom. I think when we were talking a little bit earlier, you said there is another freedom that you've experienced. Can you explain a little bit more about what you meant by that?
What do you mean by that again?
So you said about your finances and freedom.
Mm-hmm. Yeah, so definitely what I was looking for, honestly, financial freedom was not the goal at that time. I wanted the freedom of time, and I was looking for freedom of place. I wanted to do something which could produce income from anywhere. Like in between my daughter's appointment, if I'm waiting there, then I wanted to be able to just do that or even travel. And then freedom of time. I wanted I didn't want to get stuck with an 8 to 5 job. I wanted to do things when I had time, which was around my family and my daughter's schedule. And then financial freedom was not the goal. I just wanted to supplement, but financial freedom was also something which I achieved during the pandemic from the real estate, like the land and the other investment, which I made last year.
So what do you mean by financial freedom? What exactly do you mean by that?
Well, financial freedom usually means like, and that number can be different for everybody. That means that you're going to have enough passive income coming in each month that you do not need to be, which is pretty much equal to your W-2 job and covers all the expenses that you do not have to be employed if you don't want to. So that was the goal at that time for me.
Mm-hmm. That's a nice place to be.
Yes. Yeah, this is definitely freeing, and I'm like, gosh, like, I don't know how to juggle anymore. Trying to find this and that, like, what other job? And as I was telling you earlier, I was like, you know what? I know it's like in a month, it's going to be almost 2 years. I'm out of medicine. But I'm like, who wants to, like, do I want to go back to a W-2 job? Probably not. I still love medicine, but that doesn't mean I will compromise my own needs and priorities again, like I did before. I'm not going to do that anymore.
So what does the future look like for you?
Well, I just want to continue to feel this freedom, have that financial freedom, freedom of time and place. And I do know my daughter is still going to continue to need support, because already I was like, you know what? I want her to turn into normal at one point, and I want to go back to my life. Well, she is who she is, and I love her to the bones. She's a lovely little girl. It's not a toddler anymore during the pandemic, but she's still going to need some support. Mm-hmm. And I like my lifestyle like this, where I have this freedom. Now, I definitely want to continue to grow in the real estate. So I do have quite a bit of plans on that arena, which we'll see how that will go for this year, acquiring more properties, maybe giving others opportunity to have passive income, So maybe starting a debt fund or something like that for others to invest and grow with me, So that's something which is I'm kind of thinking about, and probably will be able to implement me like in a month or two.
Mm-hmm. Mm-hmm. So, if my listener wanted to find out more about what you do and how to do what you do, how could they reach out to you?
Yeah, so they can reach out to me in LinkedIn, Facebook, and on my website, like mamta-kumar.com. Yeah, these are the 3 ways to reach out to me.
Okay. And do you have any pearls of wisdom that you would like to leave with my audience?
I really think everybody has an inner knowing, and they know what is right for them. And the worst thing which we do is continue to disregard that. I really wished I followed my inner, truth that I needed to cut down work and just take care of myself. And there's nothing wrong. And I don't think we can take care of the patients if we don't take care of ourselves. We're not going to last long. So everybody should prioritize their own needs first.
This is Hope for Med, new day for Med, for us, by us, and just for us. This is Hope for Med.